somebody who's a veteran as far as the Indian pharmaceutical space is concerned, and somebody who's seen the regulatory environment in the US, the biggest and the most profitable market for Indian pharma, evolve over decades. Mr. D.G. Shah is the chief as far as the Indian Pharma Alliance is concerned. Mr. Shah, good afternoon. Thank you very much for your time, sir. Prashant this side.
Prashant.
Hi. Sir, this story which now is getting a lot of attention about the Department of Justice in the US finally this year filing charges after a 2-year-long investigation on alleged price collusion. About a dozen drugs, about 24 odd companies involved, some of the biggest generic companies in the US. How do you react to it?
Well, this investigation has been going on for 2 years. The U.S. Congress is also seized of the price increases that has taken place. But knowing the way anti-competitive forces work in U.S., I'm not sure it would be a case fit to establish collusion unless they have real evidence. And if there was evidence available, probably action would have come much earlier. This looks more like a fallout of the concern from the Congress about the recent price increases which has taken place, or even the newer drugs which have come at very, very, very high prices. But until we have a clearer picture, because these investigations included about 8 companies earlier, and all of them had submitted data. So most of those cases appears not being pursued.
Mr. Shah, 8 companies overall or 8 Indian companies?
If I recall correctly, I'm going back to a couple of years, that 8 or 5 Indian companies were named for investigation. And we had also submitted at that time data showing that there has not been any significant price increases. Almost 82% of the products, there has been same prices. Another 10% there has been a decline, and only 5 or 7% of the products there were increases. So this is coming after almost a year and a half or 2 years from the time we first submitted this data. I think it was 2014. And
when you say you had submitted, the Pharma Alliance had submitted. I mean, the industry body had submitted as well. Had made a representation.
Each individual company had done it, and as an IPA, we had made this presentation to the authorities in the USA, particularly US FDA, and some of the congressmen, that look, we are the source of most competitive priced drugs, and
so Mr. Shah,
this is our track record.
Mr. Shah, you're saying that it's going to be hard to prove collusion, and had there been price collusion, we would have already seen some action from the US authorities. How much of what's happening today, perhaps some sort of an election rhetoric in your view?
A lot of things are happening in the US. Apart from election rhetoric, the Congress has been addressing this issue. Both the Democrats and the Republicans have been also concerned about the health care. And I'm not sure Department of Justice will get involved in the election rhetorics, but the fact that they have initiated this action could be political origin. It's difficult to say sitting here.
Okay.
Right, Mr. Shah.
I'm not that much concerned based on the data that we had submitted earlier.
Okay, no, you said 5 to 8 companies, right? Back in 2014 were involved.
Right.
Over the last 2-year period, have you heard from other companies as well? Has the list become longer, or it's still that?
In fact, this came, I think, in mid 2014. Sometime it came, and then we analyzed and took a sample of drugs and showed that how, in most cases, either prices have remained stable or have declined. and only 5 or 7% of the drugs there were increases. If you look at the results of the companies, there has not been such spectacular revenue growth based on pricing.
Mr. Shah, are we likely to see a penalty? Do you think it could lead to
Department
that?
of Justice, once it takes it up, there is a provision for compounding the offense. So if company doesn't want to pursue the case, as it happened earlier in many pharma companies' cases which were related to GMP and quality issues.
Ranbaxy, of course, is one of the largest settlements.
Of course, but
Yeah.
No.
There have been many. There have been many.
Much
Yeah.
larger settlements were by Novartis and Pfizer.
No, I'm
and
talking about
Roche,
Indian
all of them.
companies. Yes. No.
Among the-
Absolutely.
So it's without admitting the offense.
Yeah.
If you want that, I want to close this chapter and compound the offense. That option is available.
So have Indian companies, I mean, in your knowledge, are they taking up on that offer? I mean, essentially
No.
filing
It's
nothing.
too early.
Too early.
It's too early. It's too early. I mean, first they would, if they have a strong case and there is no collusion which has taken place, they will not go for a settlement.
Okay.
And look, Indian companies, if there is only one Indian company name and there is no other Indian company name, that means that collusion is not among the Indian companies.
Yeah.
Okay.
Mr. Shah,
Otherwise, both of them would have been named.
Mr. Shah, thanks very, very